Welcome to this week's Keratoconus blog. I'm Dr. John Gelles, and this week we'll be speaking about the differences in manufacturing standard contact lenses versus specialty contact lenses. Standard contact lenses are the soft, pliable, disposable lenses that we're all very familiar with. They're mass manufactured by the millions per day. They're a very high volume operation which is mostly automated. If we were to compare these kind of contact lenses to cars, we'd compare these to cars manufactured by GM, Ford, Honda, and Toyota. They're very specific parameters that really work for the normal or typical population out there. The lenses are made of soft material only, and they're made in the process of a cast mold. Most practitioners fit standard contact lenses regularly and are quite efficient at that. These lenses are made, just like I was saying before, for the majority of normal corneal shapes, and individuals who fall outside of this normal corneal range typically experience issues. So individuals who have flatter than average corneas or steeper than average corneas, such as keratoconic individuals, these contact lenses may be problematic for you and may not be able to achieve the comfort or vision that you're looking for. So, how are standard contact lenses made? Well, they're made in a process of cast molding. What you can see on the left is a mold. This mold has a male and a female portion to it, and those portions are jointed together in the process. As you can see in the center portion, these molds are made for various different powers and parameters, and those molds are sorted and then sent on down the manufacturing line. Once they get to the manufacturing line, these molds are filled with the liquid material that will become the soft contact lens. That liquid fills the female portion of the mold, and then the male portion of the mold is pressed into place, and together they create a liquid-filled mold. Those molds are then placed in an industrial oven to undergo a curing process or a hardening process. At this point, we create a rigid contact lens shape. Now, these rigid contact lens shapes undergo another automated process to separate them from the mold itself. And those rigid lens shapes are then optically verified to ensure that power and parameters are all created correctly and to eliminate any imperfections in the contact lenses that are going to be made. The next process is to rehydrate these hard contact lens shapes. This process is similar to soaking a new sponge in water. The new sponge is a rigid, dry form of a sponge, and once it undergoes that hydration process, it then becomes soft and pliable. Contact lenses or soft contact lenses in this standard contact lens category are very much the same. They become soft and pliable as they become hydrated. After they become hydrated, their packaging process is completed and they're put into the familiar blister packages that we all know. Those packages are then sorted into the various parameters that they will be finally distributed in, and they undergo one last process called autoclaving. And autoclaving is a sterilization process to kill any sort of bacteria within those packages. By contrast, specialty contact lenses are custom made. There's only a few thousand made daily. They're made at a very low volume. If we were to make the same sort of car comparison, these would be more like a Rolls-Royce. They're made in very small quantities, but at very high qualities for an individual's custom needs. These lenses can be made in hard or soft lens materials, and those materials can even be combined to create a hybrid lens. These lenses are lathe cut, and that process is a subtractive manufacturing process where material is scraped away from a material blank until the final contact lens shape is achieved. Few practitioners specialize in fitting specialty contact lenses, so individuals may have had issues with having specialty contact lenses made for them in the past, but I assure you that there is a high rate of success in the hands of an experienced and skilled practitioner. Now, these lenses are made for an individual's exact corneal shape under exact specifications from your practitioner, and keratoconic individuals benefit greatly from using these lenses. If we take a look at the lens examples to the right, we can see that there is a 19 millimeter scleral lens on the upper left hand side, above a 9 millimeter gas permeable corneal lens, whereas off to the right in the upper right hand portion we have a custom soft lens for keratoconus, and below that a hybrid lens. Now all these lenses come in a variety of shapes, sizes. In fact, the combinations are almost endless. A skilled practitioner will be able to fit your cornea no matter what shape, size, or any sort of parameter that's needed. So, how are these specialty contact lenses made? Well, specialty contact lenses start by making a material blank. These material blanks are created by polymer scientists. The first thing that's created is a material liquid, and that liquid is poured into the graduated cylinders that you can see on your screen right now on the left. Those cylinders filled with this liquid material then put in an industrial oven and baked to create the solid rods that we see in the center of the screen. Then these rods are cut into individual buttons and blanks, and these blanks are then sent to the contact lens manufacturers. These manufacturers use industrial lathes, like what you see on the left, which are controlled by computer programs called computer numeric controlled lathing processes. And these are done with computer aided design programs. In the center, you can see the tool pathing of the industrial diamond and the path that it will take to cut away material from the material button. When we take a look on the right hand side of the screen, we can see that the lathing process spins the material button on the spindle, which is on the left hand side. That spindle spins at anywhere from 90 to 5,000 RPM. And then the industrial diamond, which is what we see on the right hand side, comes in and scrapes away portions of that material until the desired contact lens shape is achieved. Once we finish one side of the lens, that lens is then flipped around and the back side of the lens is completed. Once the entire contact lens shape is achieved, it then undergoes a polishing process like what you're seeing in the center left. That polishing process removes any of the striations that are left by the lathing process and creates a perfect optical surface. After this polishing process is completed, it then undergoes a plasma treatment process. And the plasma treatment process uses plasma state oxygen to clean the lens surfaces. And what this does is it also creates a hydrophilic surface so that water coats the front surface of the lens rather than beads on the front surface of the lens, so that the optical properties are even more perfect when on the eye. If the lens is a soft lens, it undergoes the hydration process like what you're seeing on the right hand side. And finally, the lens undergoes a rigorous verification process to ensure that all curves on the contact lens are manufactured to the exact specifications that the practitioner had ordered. The optical qualities are also verified, as what you can see on the right-hand side of the screen, to ensure that the prescription is precisely made to what was ordered. After this process is completed, the lens is then packaged and sent to the practitioner to be dispensed to you, the patient. Thank you for joining us this week. Next week, we'll undergo what types of specialty contact lenses are available for individuals with keratoconus. Thank you again. Good night.